Hello, 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 hello.
Hello.
Hi, everyone. Happy Monday.
Yes, happy Monday.
We are so glad to be back. We are refreshed. We are uh, ready to do this thing on today. We've been missing you all. So we're so glad to be back here on the Green Table Senior Care Live Talk Show. And so hello again. Can you all hear us and see us okay? Please put in the chat. You all know if we be out 1 week, we get rested. So we done been talking 10 minutes and you all can't hear us. So can you hear us okay? Can you see us okay? Let us know. And again, to our OGs who are here every Monday, thank you for tuning in. For our newcomers, welcome, welcome, welcome. We're so glad to have you. Please share, tag individuals in the comments. Share it on your page because listen, we have great things, great topics that we talk about here on the Green Table Senior Care Live Talk Show. So listen, we're trying to build our community. We want to sound the alarm. We want to let people know what we're doing here. And
That's right.
Let me not get ahead of myself. The people so they can hear us.
Well, I saw a thumbs up.
Okay. I think we're good. So listen, let's go ahead and introduce ourselves. I'm Jessica Wright.
And I'm Ishonda Blue.
And we are your co-hosts of the Green Table Live Senior Care Talk Show. And we are the co-owners of Innovative Senior Solutions. And we are your senior care experts. And so, again, we're so glad to have you here. We look forward to coming here and on with you every Monday at 6 p.m. right here where we make impact. We are here, again, sounding the alarm for caregivers all over the world, future caregivers, current caregivers, those who have been caregivers, those who will need caregivers. We are here for you. And so we are here to give you the good, the bad, the ugly, the do's, the don'ts, all the things you would need entering into senior care, health care for your loved one to keep them in their home and community longer. And so that's what we're here, and that's what we're all about here on the Green Table Senior Care Live Talk Show. But you know what? We always have new viewers. Always. We just be blown away sometimes. Amazed when we see people see us and they tell us, listen, we watch you all every Monday. I'm like, really? And so we always have new viewers. So Ishonda, tell them a little bit about who we are.
Yes, because we think it's very important that people know our why. And Jessica, and myself are registered nurses. We are sisters. We are your senior care experts. We started our business in 2007 because of our grandmother who told us she didn't want to go to a nursing home. She wanted to be able to stay home as long as possible. She was our very first client. We started out doing home care. We've done adult daycare. We've done personal care homes. Our mission is to improve the lives of seniors by preventing them from going to a nursing home and keeping them safe in their home or community as long as possible. Today, we are your number one choice for adult daycare services. We have the best and the most reliable daytime care. That is who we are.
All right, you heard it here. And so listen, again, viewers, as you come in, please say hello. Let us shout you out. If you're watching this on replay, you catch us on replay later on, please put replay in the chat so we'll know that you have watched. Also, viewers, listen, we have a special guest on. I'm very excited about this. This is this special guest. She is a dear friend, a best friend since grade school. And so, you know, again, just glad to have her here on the platform because she is, she's important. She's very important. She's going to give us some news, some updates. She's going to get us in the know because this is Autism Awareness Month. And so we want to bring awareness, right? And so why not bring on someone that this is their lane, right? This is what she does every single day. And so we want to bring her on to give you resources, to give you information, tools that you may need, or you may know someone may need. And so that's what we're doing this month. We did it the first Monday, and we're going to do it today. Again, just bringing autism awareness, letting you know what autism is, understanding autism. And so today we're going to further that discussion, and we're going to talk about autism spectrum disorder services and what that all entails. And so again, viewers,
Yes.
please tag someone, please share this if you know someone would benefit from this conversation. So without further ado, I'm going to read just a short bio on our special guest, Melanie Wilson. Melanie has held the position of Regulatory Service and Compliance Director for the Georgia Department of Community Health. I told you she was important. Medical Assistant Plan Division since May of 2020. One of her primary duties includes serving as the Autism Spectrum Disorder Policy Manager. Melanie has graduated from Clayton State University with a Bachelor's of Applied Science in Organizational Leadership and a Master's of Health Administration. So without further ado, I'm going to bring Melanie to the stage, and you all give her a warm welcome.
Hello.
Yay.
Thank you for having me.
Listen, Mel, listen, I have to say this. I gotta get all y'all on the green table. They have four best friends. It's Jessica, Mel, Selenia, and Kristen. I'm so proud of you ladies. All of y'all are servicing, helping people, just doing your thing. So I just want to say that to y'all. Like, y'all are
Yes,
cool.
yes.
We got to get all y'all on the green table at one time.
That's a must do.
It's gonna be a lot.
Yes.
Oh boy.
Okay.
Oh boy.
But yeah, I had to get that out of the way.
So, listen, Mel, thank you again for coming. Thank you for tuning in and coming to share with our viewers. And so we're going to jump right in, right? We got to get all the information. And so I want to start off with this first question about eligibility criteria, right? What are the eligibility requirements for children to receive Medicaid covered ASD services in Georgia?
Well, in Georgia, they have to have a diagnosis from someone who the Georgia Composite Medical Board, has deemed eligible to diagnose them. Excuse me. And once they have that diagnosis, they can, as long as they have eligibility, either through regular Medicaid or through Social Security or Katie Beckett, those would be your fee-for-service members, but they can also access autism services if they're under a CMO like Peach State or AmeriGroup, CareSource. They will also provide autism services. I don't service the CMOs. They have their own policies and their own people. I just solely do fee-for-service. So as long as they're under the age of 21 in the state of Georgia, they're able to get autism services. For some of our members, that crosses over to those who also have the Now Comp waiver. So they're able to get those waiver services, as well as the state plan services, such as Applied Behavioral Analysis, also known as ABA, which comes with your board certified behavioral analysis and your registered behavioral technician.
So 2 questions, Melanie. You said you named it was a special board or a special type of physician or something that has to give this diagnosis. Can you tell us a little bit more about that? And then some examples of some of the diagnoses.
So the board is the Georgia, I always get them confused, it's the Georgia Composite Medical Board. It's the board that that doctors go in front of for their licenses in Georgia. Different professions actually go through them for their licenses. And they actually outline who can do diagnosis. Developmental pediatricians, psychologists, psychiatrists, neurologists, just to name a few, can actually give you those diagnoses.
Okay, good. So that's how they can get diagnosed, make sure they have the right diagnosis. Now, what are some examples of some of those diagnoses?
Well, under ASD, you can be, to get our services, you can be diagnosed, of course, with autism. You can also be diagnosed, there's a few other diagnoses that are eligible: Rett syndrome, some other childhood disorders qualify, Asperger's, pervasive developmental disorders, and unspecified pervasive developmental disorders. At this time, those are the only 6 diagnoses that we allow, but we are working on attempting to get it in place. We've been asked by those from the fetal alcohol syndrome, for kids who solely have things like oppositional defiance disorders and other diagnoses that would greatly benefit from behavioral analysis. But right now we have not passed them. We are still in talks to see how we could implement that under the state of Georgia state plan.
Okay, thank you.
All right, viewers, listen, if you have any questions while we're going through this interview, please put them in the chat so we can, answer your questions. We have someone here from the state who can get your questions answered, or she can definitely get you in the right place. So definitely put them in the chat if you have any questions.
Yes.
Okay. The application process. I know a lot of people are asking about, how do I apply? So how can families apply for Medicaid cover ASD services, and what documents are needed? What is that process like?
So for ASD services, you would basically locate an ABA provider. If you're having a difficult time locating one, they can reach out to me and I can provide them with a list of providers. We try to update it on a quarterly basis, but it's not, everyone in the state, obviously, but I do have our utilization review team to pull those providers that have requested prior authorizations within the last 9 months to ensure that we're getting those providers captured on our spreadsheet. And we categorize them by the age group that they cover, because not all providers cover the same age. Some cut off at 5, some at 12, and some go all the way up to 22. State plan Medicaid actually covers until the age of 21, and then you would have to rely on waiver services for all of your needs. And I don't believe the last time that I was speaking with DBHDD that they cover ABA, but they do have other services that they can offer the member and, the family. So they would basically go to Gateway and apply for Medicaid like they would anything else. Once they're eligible, or if they have to get Katie Beckett is eligible up to age 18, and it waives the parent's income. So if you make too much for Medicaid and your child meets the level of care, it's not based on diagnosis, it's not just for autism, it's for any child that has a diagnosis or needs medical care that meets the level of care that basically says that if they can't be home in the community, they would require care in a facility. So our utilization review team would review that application and deny it or approve it based on the doctor's notice documentation. And once they have that, they would locate that provider. The provider will tell them exactly what they need. They need their psychological evaluation that diagnosed them with autism. They would check our policy manual to make sure that the test that the psychologist or psychiatrist, neurologist, whoever did, that they used the testing that is Georgia Medicaid approved. And you can find our manual just in case for any providers or any members who want to look to make sure that their actual documentation meets policy. It's on the GAMIS website under provider information, and then you would go to provider manuals. And autism policy manual is on the first page. And it'll list those tests, but you would need that, that evaluation, a prescription, a letter of medical necessity. And you'd also need, if you want in-school services, we do require you to have an IEP 504 plan, so that we can make sure that we're not infringing on IDEA. So once you have those documentation available, the provider will let you know everything. So you don't have to remember this. They're going to tell you when you reach out to them what you need, and they'll submit to our utilization team a prior authorization. And while they'll review it, and then they will either approve it or deny it based on medical necessity.
Okay. Can you, I've heard you use the term about Katie Beckett, and I'm not sure if our viewers really know what that is. Can you talk a little bit more about that?
Well, Katie Beckett is a way for members to obtain Medicaid, even if their parents make more than the regular Medicaid income levels. So sometimes you might have parents that make entirely too much, and they may even have their child on private insurance too, but they need this Medicaid in order to either pay co-pays, to help so that they're not, because a lot of children who have these medical needs, they require substantial supports. And $45 here, $35 there can quickly, bankrupt the family. So they'll do it for people with primary, those who don't have primary, but it's basically a waiver that waives the income of the parents. It does not waive the income of the child. So if the child receives any income in their name, that it does have to be disclosed on the application. So for that, actually not do that through Gateway, that goes through a different process. And you can Google Georgia Katie Beckett, and it'll take you to the state website, and it's a packet. And I'll tell you now, it's long, it looks very scary, but most of those documents are for the pediatrician. It's a basic, cover page just for the parent to fill out, the regular standard Medicaid application, and just take the rest to the doctor. It has all of the instructions, and they will take care of it. There are some services that charge. I've heard people say they pay $500 to get it completed. But literally, you just print it off, read the directions, and take it to your doctor.
Okay, that's good to know.
And I did just put that link in the chat, viewers. So if you all are looking for that, I did put the Katie Beckett Georgia Medicaid link in the chat for your reference.
And also for these kids, because sometimes, even with the autism services, like I said, in Georgia right now, the only thing we have for for autism services is ABAs. So there's other supports that sometimes are needed. And you can access DBHDD's Family Support Service dollars. And you would just Google again, Georgia DBHDD Family Support Services, and complete the application, turn it into your local community service board, and they will award up to $3,000 a year to cover things that Medicaid does not pay for. You can use them for different things. For my daughter, I do have an autistic daughter, we utilize it for things like summer camp or outings with certain organizations that are focused on children with special needs. And so that is also a great resource to have.
Yeah, that's good information there.
And what was that DBHDD
Family Support Services.
Okay. I'll put that link in the chat to you all. So while we're talking about different resources, let's jump over and talk about a waiver program, the Now and Comp waiver program, and how that supports children with ASD.
So we do have a few children who are on the Now Comp waiver. Most of them are going to be 18 and up, but again, you can obtain state plan services until you're the age 21. So you can actually have a member who presents to Innovative Senior Solutions for your day program, and they're 19 with autism, and they may have a behavioral component. And you may say, listen, we would love to take this member, but they have to have a behavioral technician with them. Do they have ABA? Let us help you get them set up with someone who can, do ABA. And then they can actually come to your program with their behavioral technician during the day. Those behavioral technicians, depending on the provider and their policy, they're able to go into the community. They're able to go with them to work. They're able to be home with them, just wherever they need to go to make sure that they can be a part of the community, because that's the main goal, is to keep, children, basically members, period, in the community.
Mhm. Yeah.
Yeah. I know that individuals with autism can go to school. I thought it was 21, but you told me today 22. They can go to high school until age 22. When do you recommend for them to start applying for the Now Comp waiver? Like
I'd
what?
easily say 15 or 16, unless there's some super something. Some children, unfortunately, have severe maladaptive behaviors, and we've had to put them on an outcome waiver earlier than that, solely so that they can access those waiver services. Because there are services that are covered under the waiver that are not covered under the state plan. So but for just your standard child with intellectual disabilities, we definitely say around 15, 16, somewhere in there. There is a long wait list, but that wait list is really accessed by necessity, really. I've seen some members go on there and within 6 months they have their waiver funded. It just depends on what's needed.
Okay. I have a question. Just thinking about a member. They are on the EDWP waiver, but I think they would be better suited under the Now and Comp waiver. Should they change, or would they get more services under Now and Comp, or should they stay under the EDWP waiver? I
So,
don't know.
that's a waiver question. That's out of my lane.
Oh,
So,
okay.
but I will say this. The good thing is that you should be able to reach out to your HCBS manager, who is Vani, and discuss it with her and run it past her. Her and Taisha will definitely take a look, and they can help to steer this person in the right direction. They may steer them back to the case manager because that person would have more, um, more familiarity with them. But I definitely would say reach out to Bunny or Taisha to talk to them about this member.
Okay. Do we have anything from any viewers? I know I've been putting
Let me
in some
double
things
check.
in the chat. I see some viewers coming in saying hello. Hi, Adrian. Hi, Selenia. Hi, Miss Selena. Hello, hello, hello. Just want to make sure we don't have any.
I don't see any questions
Okay.
right now.
All right. Mel, what other resources, anything that our viewers should know that we have not asked, that that this would be this resource or information would be very vital for our viewers? Do you have anything that we didn't ask that we should know about?
Say is by the time parents get to me, they're very frustrated. And I always wish that we had a way to get information out to them. If you're dealing with a member, or if you know someone who's dealing with a child who has extreme maladaptive behaviors, like no ABA provider will touch them because of the liability and being able to staff it. If they're willing to staff it with 2 RBTs to handle this person, they just need to reach out to me. We can, talk about it. We can make exceptions because the primary goal with the state is to keep the member in the community. So we have cases where we have to utilize two different ABA companies because maybe one can't service the hours that are needed. We have situations where it's just there's 2 to 1 all day RBTs. There's two RBTs on one person. Those types of cases do require approval from me. So definitely you have to reach out because your claims will be denied, your hours will be denied on the PA. So you have to reach out to me, engage me, let me know what the situation is, and it has to be documented. It can't just be that we feel like, but it has to be documentation to state that this is a safety concern. And the only way for us to treat this member or be there for that member is if we can do it like this.
We got to make sure.
And there are other resources in the state. We don't push them, but we do have inpatient facilities for those members who need to get stabilized before coming back out in the community.
Okay.
Okay.
And I did drop your email in the chat.
Good.
So viewers, that is in the chat, so you can definitely reach out to Melanie. It's melanie.wilson@dcha.gov. And so if you have any questions, any deep dive questions, you need to contact her. That is her contact information. And so you can definitely continue the conversation, start the conversation, share it with individuals in your family or in someone in your community that you know would benefit from this information.
You know what, also Melanie, who I've found to be a really big advocate too, is special ed teachers. I see a couple on here tonight, and we should have did a shout out to try to get more of them on, but they are also really good advocates and can spread the word.
And they actually were the catalyst for Taisha and I getting together and putting together this team to try to get the word out across Georgia to the educational community and the community as a whole, because what we realized in talking to a lot of them was that they're expected to do everything to help the parents transition, to educate the child, and they're not getting the information that they need to provide the correct information. A lot of times they're just using what people say that they've gone through and their experiences, and every child is not the same. If you've met one child with autism, you literally met one child with autism. And so you need to steer the parents in the right direction and know that, yes, now comp waivers are normally for this age group, but it's not set in stone. If your child needs something that we cannot offer your child under the state plan to keep your child safe and in the home, in the community, then we can access waiver services to do this. Another thing that we do have is the behavioral aid service. Behavioral aid service was actually created to benefit children with any behavioral diagnosis, not just autism. But it does also require an assessment by a BCBA, a board certified behavioral analyst, in order to qualify. But that is actually done under the GAP program. So we did that one a little different, but you can actually get both the behavioral aid and ABA. They just can't occur simultaneously on the same day. They can't be there. So if you need someone, we have some members who require 24-hour or even 18-hour or 12-hour care. And they kind of tag team those hours just based on what the need is. So just reach out to me and we can talk through the situation and see what would be best for your child.
Yes. And also to the special ed teachers if you have a transitional fair, we would love to be there. We bring with us resources, right? Resources and connections. So if you have those, please let us know. We would love to be a part of your transitional fair.
Yes, and I know
let you all know ABA will be, autism services will be on the agenda for the Medicaid fair in the fall.
Oh, good.
Awesome.
Good.
And right now, I know a lot of health fairs, autism fairs, and things are going on this
Oh,
month.
yeah.
So definitely tag them here in the comments.
Yeah, America's had their first autism awareness walk, I think the first weekend in this month. And then Dawson, I saw, had um, thousands of people there at their autism awareness event. And I was just like blown away. Yeah.
Yeah.
Big thing.
So definitely, please, if you have any resources, any tools that you would like to share, please put them in the chat. And so, as our viewers come in, they see them, they watch it on replay, they can definitely go there and be able to get that information as well. So,
Yes.
any other questions?
I think you did it, girl. Thank you for the information.
You're welcome. Thank you all for having me.
All right. Thank you, Mel. And viewers, listen, thank you all for coming. Thank you all for tuning in. Again, if you know someone in your community, in your family that can benefit from these resources, please share this. Please tag them in the comments. We want to, again, sound the alarm. We have a mandate to be able to spread the word, to be able to help caregivers, current caregivers, future caregivers, those who have been caregivers, those who will need caregiving. We have a mandate to be able to push out resources, to be an advocate, like I said, a resource here. And so that is what we're here to do on the Green Table Senior Care Live Talk Show.
Yes, and we definitely thank Melanie on tonight. I learned a lot.
Yes.
We want to, in recognition of autism awareness, we want to make sure we put information out there, resources out there, tools out there. So I think we've done that on tonight.
Yes. All right, viewers, thank you all for joining and tuning in. Please come back. We will be right back here next Monday, 6 p.m. live here on the Green Table Senior Care Talk Show. Set your notifications, hit your notifications, set your watch, whatever you got to do, be here.
Yes.
All right. Thank you all.
All right. Good night.
Bye.